Thank you everyone for joining us today for this webinar, Riding the Vape Train, Pairing Comprehensive TRL with Flavored Tobacco Bans. My name is Andrew Twinamasko. I'm a staff attorney at the Public Health Law Center, and I lead our team of attorneys and policy analysts who work with you all towards ending the tobacco epidemic. I would like to talk to you a little bit about who we are. We are the Law and Policy Partnership to End the Commercial Tobacco Epidemic. I know that sounds a mouthful, but it really captures what we are aimed at doing, our expertise, and also our goal, which is really to not just partner with you all in addressing the dangers of tobacco and controlling them, but also work towards ending the tobacco epidemic once and for all. We, the Law and Policy Partnership to End the Commercial Tobacco Epidemic is a joint initiative of the American Lung Association and the Public Health Law Center. We are grant funded by CTCP to provide legal technical assistance, which is free, by the way, to all of you to help achieving the goals that I lined out in addressing the commercial tobacco epidemic. There's been a lot of action in California in the flavored tobacco regulation arena. The main framework through which this has been done has been the Tobacco Retail Licensing Mechanism, TRL. The versatility of the TRLs provides an opportunity for communities to take on other measures. For example, minimum pack sizes, minimum pricing, coupon redemption, density regulations, sales in pharmacies, you name it. All of these policies aimed at curbing the tobacco epidemic and also ensuring that we are putting in place measures that equitably deliver public health outcomes to all populations and minimize disparities. So today we'll have a chance to discuss the legal and advocacy nuances of using the TRL to end the tobacco epidemic. And there's been a lot of action recently in Santa Barbara County on that front. There have been 2 communities that have developed comprehensive TRLs that have paired them with other policies. And we are excited to partner with the Santa Barbara Public Health Department in this discussion. So let me just give you a brief overview about the people who will be talking to us, whose pictures are right there in front of you. One of them is my colleague, Hudson Kingston, who is a staff attorney with the Public Health Law Center. And Hudson primarily provides legal and technical assistance on commercial tobacco control issues to public health professionals and organizations, legal professions and advocates throughout the United States. And he's done a lot of work recently in California. So thank you, Hudson, for joining us today. And we are also excited to have Megan Kinney. Megan Kinney is a health educator with the Santa Barbara County Public Health Department, and he's with the Health Department's Tobacco Prevention. She's with the Health Department's Tobacco Prevention Program. Megan received her master's degree in public health from UCS, Keek School of Medicine. Sorry, I almost gave you a law degree there. In 2019, and is a certified health education specialist. She joined Tobacco Prevention Program in December of 2019. So Megan will be speaking on behalf of our program to share their experience passing 2 comprehensive policies by leveraging community's attention to the youth epidemic. And so without further ado, let me give you Hudson Kingston.
All right, thank you, Andrew. Thanks for that great introduction, and thank you everyone for coming and joining us for this webinar today. We really appreciate your time. In case you aren't familiar with our organization, the Public Health Law Center, our mission is health through the power of law and policy. Founded in 2000, the center is located at Mitchell-Hamlin School of Law in St. Paul, Minnesota. The center is located on Dakota land. The Public Health Law Center believes that everyone deserves to be healthy. Health equity is at the core of our work. To us, health equity means that everyone has access to specific resources they need to improve their own health and maintain healthy outcomes. This requires moving beyond a one-size-fits-all approach, as well as overcoming and removing barriers that infringe on fairness, human rights, and environmental justice. We believe that for policy to be effective, it must be equitable. We also know that while we strive for health equity, it is not the current reality. There are all sorts of social and environmental stressors on communities, and targeting by the tobacco industry often serves to compound past traumas and inequities that have been built into the system. As just one example, Black Americans continue to experience the highest overall COVID-19 mortality rates, about 2.3 times as high as the rate for white Americans. There are many reasons for these disparities, likely including disproportionate use of commercial tobacco products, and the intentional acts of industries and policies that prey on communities of color, LGBTQ, and Native communities. We strive to further policies that address these issues holistically and don't offer a one-size-fits-all solution. We offer free legal technical assistance, as Andrew said, to communities, advocates, health departments, and others working on commercial tobacco control around the United States in several different ways, through legal research, policy development, implementation, and defense, as well as through a wealth of publications and resources available on our website. We also provide presentations, webinars, and trainings such as this one, but we don't represent any clients, and we do not lobby for any particular policy to be adopted by decision makers. So that gets us all to why we're here today. I am really serving as a backgrounder and sort of lay the groundwork for the great presentation that Megan will be doing at the second half. So we're going to be talking about all of these great policies that have been adopted in TRL's tobacco retail licensing ordinances lately in California, starting first with flavor restrictions, then moving on to tobacco licensing itself, talking about minimum pack and price established prices and sizes, and prohibiting coupons and other kinds of discounts. We'll also be talking about limits on what kind of retailers can sell tobacco products and where they can be. But why are flavored tobacco products the foundation of our discussion today? Well, you can see on this chart from the National Youth Tobacco Survey, between 2011 and 2017, youth use of tobacco was going down. If you look at the far left, that's the statistics for any tobacco product. And then there was a large spike in 2018 owing largely to an uptick in e-cigarette sales, which is also reflected in the middle part there, where in 2018, e-cigarettes jumped from lower than 15% to well above 20%. We don't have all of the figures yet for 2019, but we do know that in the NYTS data, the youth rate of using e-cigarettes has gone even higher in 2019, higher than the previous year's any tobacco rate. This spike is suggesting that the exponential growth in e-cigarettes use by youth is really driving the overall increase in tobacco use among young people. And youth e-cigarette users, we know, do it for the flavors. You can see here that while candy and fruit flavors have become a little less available, youth vapors have moved on to mint and menthol, which are still widely available in convenience stores and gas stations. While flavor restrictions on candy flavors make good sense, it's really a game of whack-a-mole in that kids shift to other flavors like mint if they can't get their cotton candy vape. So it is an issue where all of the flavors seem to be fairly attractive to youth, and they do substitute freely. Now, why hasn't the federal government done something about this? Well, under the 2009 Tobacco Control Act, FDA got authority to regulate tobacco products, and in 2016, the agency deemed e-cigarettes to be within that authority. But since then, they have not done much to regulate these products. Despite big announcements, FDA has not taken broad action on e-cigarettes. And though there was a lot of fanfare around the announcement that some flavors of pods or cartridges would be removed from the market, this didn't include open systems or disposable e-cigarettes like puff bars, which are still sold widely in kid-friendly flavors all over the United States right now. Similar to the vaping epidemic, there's a continued public health problem around menthol cigarettes. A study from earlier this month shows how persistent this problem has been. The study shows that over the past 20 years, the reductions in overall cigarette sales came mostly at the expense of non-menthol products, while menthol sales remaining stubbornly stuck at about the same rate, while non-menthol purchasers were able to move away from cigarettes. And this is in keeping with FDA's own research. In 2011, a requirement by Congress, the FDA's expert panel determined that menthol cigarettes have an adverse impact on public health, and they offer no public health benefits. And it concluded that removal of menthol cigarettes from the marketplace would be a big boon to public health across the country. And this is further supported by a 2013 internal report by the FDA that further found that menthol is a key driver of youth and young adult initiation. Mentholated products are associated with a deeper level of addiction, and they create more health harms when compared to non-menthol cigarettes. They're easier to start and they're harder to quit. So ever since about a decade ago, FDA had bulletproof evidence against menthol products. But nonetheless, they still haven't done very much about it. In both 2013 and 2018, they announced that they were going to start rulemaking on menthol tobacco products, but they never finished it. And in just last month, advocates concerned with the impact of menthol cigarettes on Black Americans have sued the agency for this inaction. And this lawsuit is ongoing. And while that's going, local jurisdictions have a lot to do while the federal and state authorities talk about possible action down the road. So there are many policy options for California local jurisdictions on flavor. The considerations are laid out here. Just to take SB 793 as an example, I think a lot of people on this call know that there's a statewide bill that is likely to become law soon, and it prohibits the in-person sale of flavored tobacco products, but it now has exceptions for hookah, for loose tobacco, for premium cigars, and for online sales. So while it is good to have a statewide policy that gets menthol cigarettes, flavored little cigars, and e-cigarettes out of convenience stores, it is far from being a comprehensive restriction if you can still buy a lot of these products online. And local jurisdictions can close these loopholes. SB 793 explicitly allows local jurisdictions to have stronger flavor restrictions than are set out in that bill. So we find that the best public health practice, the way to avoid playing whack-a-mole among different flavors, is to include all flavors, all products, and no exceptions in these types of prohibitions. If flavor restrictions are the foundation of our discussion today, then tobacco retailer licensing is really the bedrock on which the foundation sits. Licensing is the framework and useful system that supports all the other policies we'll be talking about today. It's much more difficult to implement and enforce any point of sale policies without including licensing. And it'll also cost the jurisdiction quite a bit of money, because without licensing, there isn't going to be a licensing fee. We have this updated TRL resource that goes over what to know about licensing and includes a model that contains all the policies I'm going to be discussing today. Instead of presenting on this for the bulk of my presentation, I'm just going to encourage you to check out this great new resource that we've updated. It's available on our website, and I think it's available to you in the chat right now. The model can be adapted to suit the needs of your community, and we would be happy to provide assistance editing and explaining this model for you. But now drilling into some of the more specific policies. Another set of policies that go well with licensing and flavor restrictions are minimum pack and price policies. These types of policies are designed to address the tobacco industry's targeting of select groups with discounts. Studies consistently show that young people are very sensitive to increases in prices, and we know that, for example, the tobacco industry has targeted LGBTQ groups with product giveaways and themed events with targeted advertising. So policies that stop those practices will be useful in protecting these groups as well. This is just a quick reminder that discounts are the primary mode of marketing for the tobacco industry. More than 85% of their spend on advertising is for discounts at the point of sale. In 2013, they spent $250 million on coupons and $7.5 billion on price discounts. So this is the main way that they are marketing, and it's the main way they're attracting new users. Similarly, the industry has been very active in manipulating its products to get around certain restrictions. So when the 2009 Tobacco Control Act set minimum pack size for cigarettes and prohibited all flavored cigarettes other than menthol, the industry changed its products to be little cigars to get around both of these restrictions. Since then, sales of flavored little cigars has exploded, and the industry shifted its focus to these products, which are starter products for youth. Instituting minimum pack restrictions for all of these products is a way of dealing with the loophole left in federal law for little cigars. So just laying out the policies that address these problems, you can think about doing things like establishing minimum pack sizes for little cigars, possibly products like e-cigarettes and smokeless tobacco even, while also setting minimum prices for these products. So the industry can't offer cheap products as they have with flavored cigars and e-cigarettes. We know the great example of Santa Barbara having set minimum prices for packs of cigarettes at $10, and little cigars have to be in a pack of 20 and also cost at least $10. And I've been recently told that there's a great tool on Partners that helps in setting that price appropriately to your jurisdiction. So definitely check that out if you're interested in this type of policy. At the same time, it's a best practice at the local level to close the loophole on giveaways and coupons that have been targeted at select groups in the past, prohibiting coupons, free samples, and volume discount sales. The last policies are also stronger when you pair them with licensing requirement that product sales can only happen in licensed establishments, eliminating pop-up giveaways in venues and clubs that are targeted at those specific groups. Now I'm going to be turning to restrictions on types of retailers and locations. A really good real-world example of pharmacies getting out of the tobacco business is when in 2014, CVS decided to not sell these products. When the company instituted this policy, it reduced the density of tobacco retailers in wealthier neighborhoods. But by contrast, Walgreens, which still sells tobacco products, has been frequently caught by FDA youth decoy purchases and has had to do a lot of backpedaling to prove that they're actually not a main part of the problem of youth sales. While CVS's choice to not sell these products, much like Target's a few decades earlier, was not because of a law, it illustrates how businesses that are there to provide health products and services should be getting out of selling addictive, deadly products, and if they're going to maintain their relevancy and claim to be interested in public health. Similarly, another restriction that jurisdictions have considered and adopted is where retailers can be located. Should they be restricted from being close to other retailers, you know, reducing their density? Should they be prohibited from being located next to a school or a park? Should they be prohibited from being near a cannabis retailer? Our model policy that I mentioned already, the tobacco retail licensing policy, suggests adopting all three of these policies, all three of these distance limitations, because there's a strong public health rationale for each one of them. Just for one example, tobacco retailers near schools greatly increase children's exposure to tobacco product advertising, if not to tobacco products themselves. But just, you can see from this top picture, point of sale advertising near schools, you know, next to the candy is a very, very frequent part of this sort of corner store sales of tobacco, and it is immediately exposing young people to it by being there and so close to where they congregate. While proximity restrictions can be effectuated in a licensing ordinance, many jurisdictions will also place consistent limitations in their zoning ordinances. So some choose to accomplish it mostly with zoning, but we find that licensing is a strong way to implement distance limitations across the board and equally among all retailers. In zoning, often it'll apply to new retailers, but maybe not to the older ones. But with licensing, it can apply to everyone equally. So sort of summing up and talking about some more of the policy options, you can consider restrictions on all of these things. Along with licensing, jurisdictions can curtail the number, location, and kinds of tobacco retailers. So this would include potentially limiting sales in pharmacies, in stores that are not adult only, mobile sales, online or delivery sales, and even curbside pickup. There's an asterisk there next to adult or tobacco only stores because that one has had mixed results really. In jurisdictions that allow flavored product sales in tobacco only stores, we've seen that applications after a policy like that goes into effect for tobacco only stores explodes. So to prevent the problem from moving to a new group of retailers that are now self-proclaimed tobacco only stores, that type of restriction really has to be paired with something like a cap on licenses or limits on the number that will be given out. Otherwise, the exception might swallow the rule. Otherwise, issues like online sales and curbside pickup have become much more relevant in California under the lockdown order of the spring. And prohibiting those types of sales is a way to maintain traditional ID checks that prevent sales to youth. You know, it's very hard with online delivery sales or even curbside pickup to make sure that the normal ID checks are being taken care of. So in addition to the distance limitations we cover in our model licensing ordinance, there are different density models that you could also consider, including capping the number of licensees in a neighborhood or based on the population of your jurisdiction, similar to how there is a cap on liquor licenses based on population. Also, with a cap on retailers, you can stop ballooning applications like the one I just mentioned for tobacco-only stores, where there's an exception for a flavor restriction. Caps can also reduce over time, allowing the number of retailers to drop by attrition, maybe even drop to zero, and this would then be an endgame policy. All of these could be paired with the policies we've already discussed, so limiting both the products that can be sold as well as the number of retailers in a jurisdiction. Okay, with that, I hope that you have a lot of background on the policy options that are available to you and that Megan will be able to talk about more in her ordinances in Santa Barbara County. We'll have time for questions and clarifications after her presentation on the county's efforts to get comprehensive policies passed in light of the teen vaping epidemic in Diwali. So go ahead, Megan, take it away from here.
Okay, thank you. Let me share my screen and presentation. Okay, thanks so much for going through all of that information, Hudson. I'll say this now and I'll probably reiterate it multiple times throughout my presentation, but our work would not be possible without the Public Health Law Center and their legal technical assistance. So thank you and welcome to my portion of the presentation. My name is Megan Kenny and I'm the health educator with the Tobacco Prevention Program at the Santa Barbara County Public Health Department. We are a local lead agency under the California Tobacco Control Program. Now, although I will be the one presenting today, I hope to speak on behalf of my entire program. As was mentioned in my introduction, I only just joined the team back in December of 2019. So a lot of the work that I'll be speaking about today actually happened before I started. So I want to quickly introduce the team before I speak about all of their amazing work. Chantal Hoover-Jones is our program coordinator. Julissa Ramirez served as our program's health educator throughout the policy work that I'll be talking about today. And she was very nice enough to actually provide a lot of information when I was putting together this presentation, even though she now serves as the health educator for the tobacco education program in Glenn County. So thank you for your help, Julissa. And finally, Celia is our office administrator, and I have to include her also because she keeps our program running, as well as she oversees the TRLs that we are contracted to enforce. So now that we have those introductions taken care of, you're probably wondering why we named this presentation Riding the Vape Train. And that's because I'm going to be talking about how our program harnessed attention to the youth vaping epidemic and local interest in flavored tobacco bans to pass 2 comprehensive tobacco control policies. So let's get started with our story. As we all know, and as Hudson explained, with the introduction of appealing flavored electronic smoking devices, we saw a huge resurgence in youth smoking. And it wasn't until December of 2019 that our Surgeon General actually coined this the youth vaping epidemic. And it was about this time at the end of 2018 that we saw within our program, I'm sure many others experienced this too, this is when we started to notice an increase in attention to youth smoking among the general community. So the people beyond our kind of usual circle of anti-tobacco partners and health partners. And it was really the beginning of 2019 that our program really started to identify some tangible policy options in response to the youth vaping epidemic. And I'll be speaking about two jurisdictions today, the city of Santa Maria and the county of Santa Barbara, so the unincorporated areas. And from what I know, both policies started with a combination of both community advocacy as well as policymaker interest. So they both kind of started at the same time. This policy work was further motivated by the increased prevalence of EVOLI in the summer of 2019. And finally, both policies were presented at public policy meetings, I'd say around the end of 2019, fall 2019, right after the National Youth Tobacco Purchase Survey demonstrated that nearly a third of high school students reported using e-cigarettes last year, which was a major talking point for us throughout that entire process. So the youth vaping epidemic was getting more and more attention. And within our county, we saw parents, educators, and physicians serving as the first groups to actually start speaking up about this issue. And this is where our program and all of the other CTCP funded programs come in. We provide a vehicle for the community to challenge or to channel their energy toward making positive change by way of local policy work. So this is where we jumped on the vape train and allowed our community's focus on the youth vaping epidemic to really lead local policy work. And why I'm presenting today is to highlight how our program leveraged this push for local policy work to not just ban flavored tobacco, but go above and beyond with comprehensive tobacco policies, the ones that Hudson was just outlining. And I know we're definitely not novel in our practices and our outcomes, and I know pretty much every other CTCP funded program with policy objectives is likely doing the same thing at this time and is still continuing to do that. But I will share with you specifically how our program was able to achieve this. And I've broken it down into 4 steps for you, kind of 4 key phases. So first, our program, and when I say program, I'm speaking about my coworkers who I introduced previously, as I wasn't around at this time yet. But our program harnessed attention to the youth vaping epidemic to continue to build kind of more attention and more exposure to the issue of youth smoking. And then second, we went further to engage, as Julissa told me, anyone and everyone we could connect with. And third, while engaging these organizations, individuals, and communities, our program sought to provide education on tobacco control policy work, which is really what laid the foundation for the comprehensive tobacco policies. And finally, fourth, our program forged relationships and fostered continued advocacy throughout the entirety of the policy process and beyond. So this is just a quick overview. And now I'll jump into each of the steps. So as I said, first, our program really harnessed attention to the youth vaping epidemic and EVOLI, which are the 2 issues that we saw really ignite action in our community. And as I mentioned, parents, educators, and physicians were the first groups we saw become very interested in this issue. In an effort to kind of start circulating more education and more information to the public, our program started with really trying to bolster our social media presence through just increased posting and engagement. And then our local coalition, who I have to mention, of course, is CEASE, which stands for Coalition Engaged in a Smoke-Free Effort. They were very involved throughout all of the steps I just outlined. And we're very lucky to have such a dedicated group of individuals who've been advocating for tobacco control policy in Santa Barbara for over 30 years now. I'll mention them throughout, but they were most definitely involved in harnessing attention to the youth vaping epidemic, to educate the community and to start recruiting more members, which was really important for the policy work. So one of the ways CEASE did this was they created a new group under their Facebook page called Parent Connect. And the page served as a space for parents to communicate, and then where also members could post about upcoming coalition meetings, task force meetings, and public policy meetings. So on top of that, our program started to connect with physicians and educators that we saw actively speaking up about the youth vaping epidemic in the community. And we invited them to coalition meetings. And given that these individuals are often well-respected members of the community, they were definitely impactful when it came to working with policymakers. And they could also give firsthand accounts of how these products were affecting, the youth in our community, which was really important. And lastly, youth themselves were incredibly instrumental in serving as a voice for their peers throughout this entire process. So we're really lucky to have some wonderful youth serving organizations we could partner with throughout this too. So that was the first step, kind of harnessing their growing attention to the youth vaping epidemic. And then next, in the words of Julissa, as I said, our program engaged anyone and everyone. And we had a host of people who were suddenly very interested in tobacco control. And it was our program's chance to provide then the resources and the education and the avenues for change. So our program worked very closely with two organizations that I'll talk about. The first is the Santa Barbara County Promotores Network. This is an amazing organization consisting of 200 around community health workers. And these individuals are both respected members of the community, but they also understand and respect the traditional beliefs of Latino culture here in Santa Barbara County. And they engage the underserved and marginalized Spanish-speaking immigrant community in our county around health issues and access to healthcare. And while our program and really our entire health department has worked with the promoters for years, we forged some new, unique relationships when working on these policies. So that was the first organization we really partnered with. And the second is Fighting Back Santa Maria Valley, which is a nonprofit organization that focuses on reducing substance use and violence just to promote a healthy and safe environment in Santa Maria Valley. And again, we've worked with them before, but we hadn't necessarily partnered with them on a policy like this before. And it was really important to us because they lacked that on the ground kind of local knowledge in North County, Santa Barbara that we really needed. And as you can see, there's many other organizations listed here that our program engaged with. Some are trusted partners we've been working with for years, and some were completely new, but all were interested in learning more and getting involved. And so we took full advantage of that. So now that we've engaged these individuals and organizations, it was time to educate. And Chantal and Julissa scheduled presentations with almost all of the organizations that were mentioned on the previous slide. And first and foremost, these organizations in the community really wanted to learn more about the youth vaping epidemic in Uvalde. And so our program was able to provide credible information and timely research on this topic, just to clear up any misconceptions, but we did not stop there. Our program then went further to explain the history of the tobacco industry, their marketing tactics, the targeting of youth and minority populations. We discussed the issue of flavors and how they appeal to youth in their smells and packaging. We discussed point of sale marketing, coupons, as Hudson was explaining, coupons, discounts, proximity to schools, and really just outlined the many injustices of the tobacco industry and overall their new ploy to hook a new generation of users. And for me personally, this information was kind of what sent me over the edge when I learned it first. And I'm hoping I would imagine it did the same for many others, because it really makes me furious to hear this and to learn this. So this education was then promptly followed by information on tobacco control policy work and action items that could be taken by the community and local government. Included in these policy options was not just a flavored tobacco ban, but tobacco retail license, sales restrictions, minimum pack and price, pretty much everything Hudson just went over. And this is where we help the community channel their concern, their anger, and their fury even sometimes, because when you see an upset mom whose child was addicted to nicotine, fury is a great way to describe kind of those feelings that they have. So we're able to help them channel those feelings into action through this education process. And this almost certainly had to then be followed by training on how to carry out these actions. So we provided more education and capacity building trainings that taught advocacy tools and tips for crafting speeches, talking at public policy meetings, how to have a meeting with an elected official, all that stuff that we learn. And again, this is what we do. We are the educators and the technical experts who provide kind of the fuel to the fire that is tobacco policy work. But the community and the stakeholders are the match. So forgive my silly metaphor. And I've included some slides from the presentations that Chantal and Julissa used. And you can see that these are some slides that just discuss, marketing strategies around flavors, the health effects of vaping products, as well as the youth vaping epidemic and Juul's infamous vaporized marketing campaign that they'll never be able to live down. And then these are some of the other slides that were used. So you'll see information and education on tobacco retail licensing, minimum price requirements, how to meet with elected officials, and then some, top talking points when speaking with people. So really quickly, I just want to highlight one example of kind of that whole outreach education process. And I mentioned that we work with the Santa Barbara Promotores Network. And typically in the past, this organization has served as a subcontractor for our program, and staff will usually attend tabling events with us, but our program engaged the organization in a different way, in a new way this time. So we invited many of the Spanish-speaking community health workers to play an active role in the policy work. And I'll credit Julissa for assisting with most of this work, as she is a native Spanish speaker and was able to effectively provide education and training to this group. So Julissa connected with several of the promoters and invited them to our Midwest Academy strategy chart meeting. And she was able to translate English to Spanish and vice versa, so we could all communicate. And the promoters who came provided a lot of really helpful information and insight that we definitely wouldn't have otherwise received. And additionally, Julissa identified several promoters who wanted to actually speak at public policy meetings. And so she provided guidance, again, as I said, on crafting a speech and communicating with policymakers. And as a result, we had several who spoke at public policy meetings, and they provided their public comment in Spanish, which was later translated. And I can tell you it was really impactful and really amazing to have them there. So, okay, now we get to the fun part. So we had a community who was educated and ready to demand tobacco control policy from their local governments. And then these individuals met with policymakers, sometimes at scheduled meetings, sometimes out in the community or at events. And then they passed along their knowledge that we gave to them of the youth vaping epidemic, the health effects, flavors, tobacco industry tactics, and how a comprehensive policy was best for protection of the community. Once these jurisdictions showed considerable interest, we were able to step in and start providing technical assistance in partnership with the Public Health Law Center. So for both the City of Santa Maria and the County of Santa Barbara, our first step was to kind of jump in, give a brief overview of tobacco policy landscape, and then provide a model tobacco policy ordinance from the Public Health Law Center. And this ordinance itself includes a strong flavor ban that includes menthol, as Hudson was explaining. And from what I've learned, very well thought out definitions that kind of cover all of the products on the market, and probably a lot more legal technical subtleties that I'm not even aware of. But basically what I'm getting at is that it's a very strong policy. And it's so nice to be confident that we are giving jurisdictions something that is so strong and that is perfectly packaged. Because from my short experience so far, I've learned that no one really wants to actually draft these policies themselves. So the County of Santa Barbara already had a strong TRL, so their policy just included a flavor ban, as well as many of the plug-in policies that Hudson went over. And then the City of Santa Maria included a TRL because they didn't have an existing one, a flavor ban, and then several of the additional plug-in options. So once those policies were handed over to city staff, we would wait, and then they would get back to us, and then we'd provide more technical assistance, and then we would wait, and kind of the cycle would continue. And then until finally they let us know that they were ready. And then it was time for the public policy meetings, which in my opinion is the most exciting part. So the city of Santa Maria was the first to draft an ordinance, and it included a tobacco retail license, which I've just been made aware of the new fees that they determined. So it's a $600 application fee, $480 for annual renewal, which should definitely help their American Lung Association report card because those are high fees. It also includes a flavored tobacco ban that includes menthol, and it covers all flavored products. So that includes cigarillos, cigars, chewing tobacco, snuff, snoofs, and then any disposable e-cigarettes, pods, and cartridges, as well as e-liquids or e-juices. And the ordinance also includes minimum pack and price, and I've included the prices here. So $7 for a pack of cigarettes, $5 for a pack of 5 cigarillos, and then $5 for a pack of 5 cigars. And let's see. No coupons, discounts, or deals, as well as no tobacco in pharmacies. So it's a pretty awesome ordinances. These prices were a little lower from the initial model policy that we gave them. But again, you know, this is what the city set and this is what they wanted. And we provided as much information, education as we could. Sometimes you just can't win them all, but at least there's minimum pack and price restrictions. So they're still pretty strong numbers. And then as far as the actual meeting, I've included some images of our awesome coalition members and community partners. And if anyone has been in tobacco for a while and recognizes Dawn Dunn, who preceded Chantal as our program coordinator, now that she's retired, she's able to speak in support of these ordinances at our city council meetings, which I know is really exciting for her. And we have our CEAS member who was responsible for the Parent Connect Facebook group. And she spoke with her son, and another, the executive director of Fighting Back Santa Maria Valley spoke, and many others. I can't remember exactly how many we had in Santa Maria, but I'd say at least 20 or more speakers in support, all wearing our shirts that say, "It's not like you can buy a new brain." So I have some other photos from the Santa Maria City Council meeting. As you can see, it was standing room only. I heard it was very intense. There were a lot of those there in opposition holding signs that said, "We vape, we vote." But at the end, we prevailed and the ordinance passed on the second reading. So Santa Maria now has a TRL, a flavor ban, and sales restrictions that were listed on the previous slide. And the ordinance went into effect in July of 2020. Let me just check time. I'm not talking too long. Okay. So on to the county. The model policy we presented to the County Board of Supervisors and staff went relatively unscathed. You can see that they passed a flavored tobacco ban with minimum pack and price restrictions, no coupons, discounts, or deals, and then no online sales. And the county has an existing TRL, and I've included the fee here below. So our program partners with the sheriff to enforce this. And as I said, we have a fee of $379 that's charged to the tobacco retailers annually. And we didn't have quite the turnout, surprisingly, at the Board of Supervisors meeting that we did in Santa Maria. I believe we had 30 speakers, 25 in support, which is a testament to our amazing coalition. So the image at the top of the slide is of a youth representative from Future Leaders of America, which is one of our amazing partners here. And she was talking about kind of the addictions she saw in some of her classmates. And she told a story about how she knew several high school juniors who were invited on a free trip to go visit colleges, but turned it down because they wouldn't be able to vape on the bus. So her speech was very impactful. We also had teachers speak of students ghosting in class and passing out and having to call an ambulance for them. And then our pulmonary and critical care specialist from the hospital spoke about, patients who potentially had EVALI. So it was very impactful having all of those public speakers. And then I love the second image here that I've included. So this is Chantal, our program coordinator, giving a presentation to the Board of Supervisors with our director of the Public Health Department looking on. So in a nutshell, this was our ordinance in the county. And it passed on the second reading in January, I believe, and it went into effect in March of 2020. So that was us riding the vape train. In summary, just to kind of go back over it, so our program identified the increased attention to the youth vaping epidemic in the community, and we harnessed that attention and tried to engage anyone and everyone we could. And with that, once we could engage these individuals, we provided education on tobacco policy work and the importance of comprehensive ordinances to effectively protect youth. This was followed by the drafting process in partnership with the Public Health Law Center. And finally, the result was 2 awesome ordinances, lasting relationships, and a safer community overall. So I'm going to quickly touch on implementation because this is largely what I've been working on the past several months. And like many programs, we passed these ordinances and then said, okay, so how do we enforce it now? So we put our brains together and devised an implementation plan that consists of what I've laid out here and is really, so far as we can tell, kind of our best practices, but we're definitely always open to learn what everyone else is doing and make adjustments. So I'd love to hear that too. So this is our implementation plan. I'll quickly run through it. First step is to create an implementation plan when it comes to these ordinances, and it's always helpful to share that with the city or the jurisdiction that you're working with. Next, I've learned best thing to do is call retailers right away. Some of them might not have heard about the new ordinance yet, so it's always good to let them know as soon as possible, unless you did outreach to the retailers or the jurisdiction did before the policy. They might not know, and so it's better to tell them, you know, the week of rather than 2 months later, because they just like to be informed. Next is sending out an official notice letter. And so with the county, this is something we did, but we've drafted a letter that we give to jurisdictions like the city of Santa Maria so they can send it out. And this, I found, it's okay to be a bit more technical in your writing, to reference Muni code, just so it's something that they have, that they can reference that legal language if they need to. But then we also worked on creating a product pamphlet that is a bit more user-friendly, has a much lower health literacy level, and includes a lot of images. And so our program created this packet that we can then tailor to different jurisdictions based on what their ordinance is. And we also created one in Spanish too. So again, it has a lot of images, and we found that retailers really like to see this. And usually we'll send it out with the notice letter. During COVID, that's kind of what we're doing, or we'll give it to the stores during in-person visits, which I found was really helpful. So when the county ordinance passed, I visited, we have about 65 stores throughout the county in the unincorporated areas. So I visited all of them, gave them the product pamphlet, answered questions, got to know them. They were really happy to see me. And one of the things that we also put together for them is a little sheet at the end of our product pamphlet that includes resources for small businesses. So this included a link to a local organization who provides free business mentoring, as well as the services available through the California, I believe, Small Business Administration Bureau, as well as some federal level assistance packages for small businesses. So we had about 5 or 6 vape shops in the unincorporated areas who, when we went to visit them, when I talked to them on the phone, you know, looked me in the eye and said, you do know that you're putting me out of business. And, you know, this is my livelihood. Like, how could you do this? And it's definitely hard to hear. I have to remind myself that these individuals chose to sell the #1 cause of preventable death and disease in the United States. And that's really their responsibility. But at the same time, you know, we learned, and I quickly learned, the best approach is to really partner with these people and get to know them, because they're not going to go away right away. And we really want to work with them, especially when it comes to end game planning. We really want to empower these people to sell the best thing for the community. And that's definitely not tobacco. They still want to own a business, and they still want to have a storefront. And so what I would tell them, and it stuck with some, maybe it stuck more, they just didn't tell me or make it known. But I told them that, you know, if they had the determination and the guts to open a small business in the first place, that they could do it again. And they didn't have to sell tobacco. They could sell something that was far better for the community. They could open a sandwich shop or a coffee shop. So this was something that I learned, and I apologize if anyone's had to listen to me say this again, because this is like the most valuable information that I got out of working on implementation. So that's kind of a wrap up of our in-person visits. And we can go into this more, but Hudson and I also got to work on product disposal because the county's ordinance went into effect 3 months after it was passed. And so a lot of the retailers were calling me and saying that they were going to have leftover products. So liquid nicotine is under California law an acute hazardous waste. And so they needed to dispose of that properly. So we set up disposal guidelines. I worked with our California or Santa Barbara County Resource and Recovery Waste Management Program. So they could dispose of the liquid nicotine as well as the disposable products have batteries, which is e-waste. So that's a whole other conversation that we could probably spend an hour talking about. And then finally with implementation, there's just a lot of ongoing TA. So answering questions, being there for the retailers, and getting to know them. So I will wrap it up with that. Feel free to contact me. Like I said, I'm new to tobacco, so I'm still learning. And I learn so much from everyone that, you know, I get to interact with in the tobacco control realm. So very happy to speak today on behalf of my program. And I will turn it over to Andrew to answer a few questions.
Great. Thank you, Megan, and thank you, Hudson, for that really good discussion about riding the vape train. I think the legal nuances and the advocacy aspects, just a combination of them, the information is very, very valuable. And as I mentioned, we have a few minutes remaining for some questions, and there have been some questions that have been coming in. And if you have any other questions, please submit them, and we'll be able to try to go through them. And even if we're not able to cover them, we can follow up via email. So there is a question here, and I think this is for both panelists. So whoever feels that they can answer, either Megan or Hudson, please go ahead. How did Santa Barbara County and how does SB 793, if you know, deal with concept flavors that don't specifically name a flavor in the name of a product like Tropical Sunset? Will those be banned for sale as well?
Megan, do you want this one?
Well, I was going to say, do you want to explain kind of the definition and how that covers everything in the policy?
Yeah, so I think both Santa Barbara's ordinance and SB 793 would cover those types of concept flavors. They do it by saying that if a product has a taste or aroma other than tobacco, then they're covered. I think the question points out a really big difficulty in implementation about packaging and about the tobacco industry trying to conceal the fact that something is a flavored product. But by using a definition that uses, you know, an aroma, basically the way to enforce it is to rip it open and smell it, which is much better than having, you know, requiring a lab test or something expensive and time consuming. So I do think that the definitions generally would cover those type of products. What do you think, Megan?
Yeah, that's my interpretation of it. And from kind of an enforcement side, I had to make that known to retailers. So they had a ton of questions about what products are flavored, and that's totally understandable because it's very confusing. And so they would pick up something that was blue, you know, the actual product name was called Blue Cigarillos. And so I would ask him, does it taste like blueberry? Do you know if it has a taste or smell? There's basically all the concept flavors, or, you know, trying to mask the fact that it's actually flavored. And so I just had to explain to them, if there's a taste or smell, it's included in the ordinance. Unless it's just pure tobacco flavor, then it's included as a flavored product. And so that wasn't something that we found is really important to include, because they said, well, look, it doesn't say it has like a flavor to it. I'm like, well, but it's blue, or it's green, or it's orange, or it's tropical paradise. And so we had to make that known, but we're lucky that the definition kind of covered all of that.
Great. So the next question is, for either of you. There is a question of, we talked about minimum pricing and how that applies to electronic cigarettes, knowing that there is no meaningful national regulatory uniform regulation of those products, unlike cigarettes and little cigars. What is the best way to regulate minimum pricing for e-cigarettes?
Yeah, I think I can take this one. So the question does imply that it is hard to do, and that's true. I think it's very hard to conceive of a minimum price for e-cigarettes because they're so different. But the way that minimum price works for packs of cigarettes is, first you require a pack of cigarettes to be a unit of 20, and then you price that thing. So really the best way to think about minimum price is you define what can be sold. And once you know the type of e-cigarette that you're allowing to be sold in your jurisdiction, you can place a minimum price on that, either based on the nicotine container it has, or based on having a heating element or something like that. You can come up with a way to define the product. But really, minimum price only happens after the product is defined as a specific thing. And a good way to do that would be to not allow the sale of many types of e-cigarettes and then set a minimum price on the one that remained.
Awesome, thank you. This is a question for you, Megan. How can we get a copy of What Can Be Sold poster from Santa Maria?
So it is available. I believe the one that we made for the county is available on Rover, Tobacco Control Library. But with that being said, we created it in Canva. So it can be tailored to any jurisdiction. So if you're interested, you can definitely send me an email and I can send it to you via Canva, and then you can actually change the wording for your jurisdiction if that works for you. So I can also, I'll leave my email in the chat again, just in case anyone wants it.
Great, thank you. And I see we have a couple minutes, so let's try to go through some of the questions that are still coming in. Megan, did you come across any retailers without a state license? And if so, how did you handle the situation?
That's a good question. I didn't. And to be honest, that was not something that I was like really keeping an eye out for. I used that as kind of background information for someone who wasn't familiar with a local TRL. So they would be like, wait, I'm really confused. Why do I already have a tobacco license? And I would say, okay, so you have one from the state. Now you need one from the city, similar to potentially business license if the city gives that. But I wasn't necessarily looking for that when I went on my retail visits. But I think it would have been a great use of our time to do kind of the stake, act sticker checks and the license checks when we went out. So thank you for mentioning that, whoever asked that question. But I did not come across anyone who didn't have a state license that I know of.
All right, great. Very, very last one. How do we best build relationships and hopefully partnerships with store owners who sell flavored tobacco products? What is the first step and steps following towards a flavor ban look like?
Well, I'll speak on behalf of kind of the experience that I had working with retailers. And I think that the first thing I learned was just to not be an authoritative voice to them. Just to come in with that, idea of being a partner rather than someone who's going to come in and tell them what they can and can't sell and, potentially tell them that they can't sell any of their products. So really come in with that mentality that you're there to partner with them rather than be an authoritative figure who's taking away all of their product, and listen to them. I think this is generally anything you might do, when you're trying to partner with anyone, whether it's another agency or organization or anyone. Tobacco retailers kind of follow that same mold. Listen to them because they probably want to tell you a lot about how what you're doing is affecting them. And, you can be understanding and say like, yeah, I know it's hard. You open a small business and now you're being told that you can't sell anything and you worked really hard, and let me help you to the extent that I can and empower them to do something better for the community. but definitely take that side of being a partner rather than a foe. I think that's maybe my best advice. And then use whatever, you know, capacity building skills or just personal skills that you have to interact with them. And sometimes that means sitting on the phone for almost an hour. We've had people call and just complain, and you just say, like, yeah, I know. And then ask them if we can help them, you know, determine if a product is flavored or not, and then let them go. So that's kind of my best advice. And I'm definitely still learning as we go along. But as I've said, like, I'm hoping that this helps us with end game strategy, that we just really get to know everyone. They know my name, I know their name, and we all work together in the long run.
Great. Well, thank you so much to our presenters, and thank you everybody who tuned in today. Obviously, we've had a really vibrant discussion about this, and I see that questions that haven't been fully answered. But in the interest of respecting everybody's time, we'll have to end here, and we'll respond to every other question via email. And please feel free to reach out to us, even if you have questions that haven't necessarily, on subjects haven't necessarily been covered in this webinar. Thank you again for joining us, and have a great rest of your day.
Thank you.
Thanks.